want to give a very, very warm and spring welcome to all of you here today. We're all here in Sacramento. We're here at the Capitol, and we are here to do some unified advocacy. We've got a language access bill going.
Hopefully you all have heard of SB 1070, right? Raise your hand. If you haven't, you're going to by the end of this, I can assure you.
So I want to thank Asian Health Services for having me today. We know that language access is crucial for immigrant communities. I think it's something we can try to push and hopefully get past this year.
Hello，所以现在他除了现在是吃人奶是吧？
对。
I came to Asian Health Services after I finished grad school at UC Berkeley. I was trained as a pediatrician. When I was in my training, I became introduced to the principle that healthcare is a right. So I was very, very wanting to work in that arena, and was told that there was an opening at Asian Health Services by the Asian Law Caucus lawyer Neil Gotanda. This was totally by word of mouth. He said, you should check it out. And little did I know that nobody else had checked it out, as far as I know. And I was the only one who interviewed.
谢谢陈医生。
不谢。OK。
到外面去吗？
在这儿。
就在这儿。
等一下。Steve Yi was the director. Karen Mori was the administrative assistant. And Robert Pond was the clinic manager. We were going to have to start from scratch and be the first community health center in Oakland, Chinatown.
When Asian Health moved to Chinatown, they rented office space across the hallway from my office. I was an architect at that time. They found out that I have a kitchen sink in my office. The only kitchen sink in the whole building. And they say they need a kitchen sink. I say, okay, I swap space with them. And Asian Health is growing so fast that pretty soon the hallways become their lobby. All the people are all outside sitting in the hallway. They're running out of room.
At the time, there was sort of a lack of adequate medical care in Chinatown and the surrounding area. In fact, there was only one medical practitioner in Chinatown itself. There's also a perception by the surrounding medical community that we didn't need anything, despite what we found in our surveys that was done in 71, 72, 73. One reason is people did not go elsewhere because they didn't know what to do. Well, most did not speak the language. And many who work in industries like waiters, seamstress didn't have health care either. Our generation we were offshoots of the civil rights movement. And in Berkeley, where I was, there was the Third World Strike, which led to ethnic studies. There was the anti-Vietnam movement. So that sort of shaped where I was coming from.
The mission of Asian Health Services, the dual advocacy and service philosophy, really came out of the movement of the times. We could make fundamental change if we were organized. I came to Asian Health Services in 1976 as a patient. I was a single mom and we had no health insurance. I was between jobs. So when I came to Asian Health Services to work at, it was like a perfect match for my political and personal aspirations and passion for making social change. I found that this was also a good place to utilize that skill set in building Asian Health Services into the vision that many of its founders had set out.
This is an examining room at Asian Health Services here in Oakland. The belief is that all people have a right to quality health care, regardless of income, regardless of their ability to speak English.
One of the milestones of Asian Health Services was Proposition 13. In 1978, the county declared that they were going to cut all the different programs under revenue sharing. Asian Health Services was faced with potential termination.
We were just 4 years old when this happened, maybe 7,000 patients. And there were patients who were telling us, oh no, you cannot close. One of the strategies and tactics was to do the clog. We closed our clinic. We took our patients to Highland Hospital because they said, well, Highland can take care of you. If county-funded clinics like Asian Health Services or La Clinica de la Raza close, well, they can go to the county. There were lines out the door. Not only they couldn't accommodate the numbers, they didn't have the bilingual staff. And it proved very visually that the county was not able to provide services. There was this tremendous outpouring. We got thousands and thousands of petition signatures. People were totally fired up, including our patients and staff. The memorable footage of Sherry Hirota calling out the board of supervisors.
People fly to us and say, we are drawing the line somewhere. You've been doing this all damn year long.
Some of those CBOs that criticized us for closing and not continuing to provide services, actually they got cut. Asian Health Services was seen as a very vocal, strong advocate, not only for their own community, but for the broader community.
There was always a feeling that the community in which Asian Health Services existed in Oakland Chinatown was kind of a stepchild of the city. We were right at the intersection where cars were jumping on the freeway to San Francisco, and the fact that it was this through ramp to Alameda. There wasn't enough time allotted in most of the traffic signals to allow seniors to cross the street. When Steve Yee's father was killed, we looked into it and decided there needed to be a better way for the traffic to be controlled.
It was overwhelming for us to see what happened to my dad. And Asian Health Services, I was on the board, and they wanted to do something to help us. Sherry, being Sherry, I said, let's make pedestrian safety as part of healthcare. In fact, one of the first people to come out to attend to my father was an Asian Health Services staff member. And so Julia was assigned the project.
At the time, I was a program planner, so I was writing grants, and I remember thinking this was really like a pedestrian safety issue at its face. But really, when you take a step back, this was really more of an environmental justice issue. This was more of a city community issue. And that meant really how you define your problem really speaks to how you identify solutions. So I worked with some of our youth in our youth program at the time, had the youth just start collecting statistics.
Next item C, a presentation by the Asian Health Service Youth Program on the results of their independent study of pedestrian safety.
The father of one of our board members, Mr. Hong Yi, was struck at an intersection in Chinatown, and he passed away 4 hours later. And you can see at one point at 9th and Webster, people have to walk 11 feet per second just to make it across in time.
Another solution is to investigate new pedestrian safety technologies such as the diagonal crosswalks.
So I want you to know that you're doing a good thing, that you're actually going to make some changes in the city.
Felt really lucky to find someone in the city council member Danny Wan, who was a champion and willing to work together on this. And so we started to write a grant, and we got money to be able to put together what's called Revive Chinatown. And the whole premise of Revive Chinatown was to really figure out how do we not only make Chinatown safer for pedestrians, but also how do we really create economic vibrancy for Chinatown. And so with the partnership with the city, we got $500,000 to actually move on some capital improvements, the Revive Chinatown plan. That's where we were able to get this 4-way crosswalk that had a pedestrian phase only, no conflicts with cars, and at the same time it was a Qing Dynasty pattern. And so with those capital improvements, we were able to get 4 of them throughout the core of Chinatown. And that was really inspirational for me because it was a 5-year, gosh, it was probably like 5-6-year journey through doing all of this. But it was about bringing these diverse partners together, bringing the community input, our patient input, and actually see it become real.
To me, it was very gratifying seeing the involvement of the students, another generation that was learning values.
I was 4 years old when my family escaped Vietnam on a small fishing boat. I would say that the early years of resettlement were really, really difficult. My parents had no income. They barely spoke any English. And so I served as the child interpreter. Unfortunately, my mom was in and out of the hospitals. And I remember being in grade school and going into the hospital and waiting all night with her to be the interpreter for her. And it really traumatized me. It shouldn't be on the shoulders of the children to interpret for their parents. Here at Asian Health Services, we have made language barriers a non-issue. We ensure that our patients get the services that they need in language. But we recognize that that's not true once they go outside of Asian Health Services. During the pandemic, we saw a lot of rollback around language access. When the vaccines were available, there was a lot of demand for it. And Asian Health Services was able to vaccinate many of our patients and their family members. But we heard stories that when our community members were going to other sites, they were not able to schedule in language, they were not able to get the information that they needed, and frankly, they were left out. We recognized that this was a violation of Title VI, and we started collecting the stories and sharing that to the Department of Justice to say that language access is a right for our community. Currently, Asian Health Services is sponsoring a bill that would push for an Office of Language Access within California.
SB 1078 would create an Office of Language Access within the California Health and Human Services Agency, CalHHS.
My name is Julia Lee. I'm the CEO of Asian Health Services. We started 50 years ago because we saw that language was a key barrier to healthcare access. This past April, we decided that we needed to go up to Sacramento, that we needed to have a presence at the Capitol, that we needed to be unified with our voices across the state to really stand up for AA and NHPI health equity. In addition to the visits to our electeds, we also mobilize on attending the hearing on the Office of Language Access bill.
Bill 1078, Senator Min, whenever you are ready.
The bill was being heard by the Senate Health Committee, and we had over 30 advocates and supporters who came up to voice support for the bill.
In support. Strong support, thank you. Support.
Strong support of SB 1078.
Strong support. And strong support.
Strong support. In strong support. In strong support. In strong support. In strong support.
Strong support.
Strong support. In strong support. In strong support. Strong support.
Strong support.
Strong support.
Ben Wong, Asian Health Services, in strong support.
Congratulations, Senator Min. You had quite the entourage with you today. Bigger than Miss Hilton.
They heard Paris Hilton.
Yes, yes.
And as a result of the overwhelming support that was articulated, the Senate Health Committee unanimously approved the bill to move forward.
Thank you to our great witnesses who testified today, and thank you to all of you for helping us get through. First step passed, and we got a little bit more to do, but let's keep growing.
We continued to meet with legislators on both sides, and the bill successfully passed through 5 committees, all the way up to the Senate Appropriations. Unfortunately, we got news in September. The bill did not get approved. Even though the bill did not pass, we still gained so much, because what we built through the process was our mobilization power across the state, a stronger AA and NHPI community voice, and deeper connections across diverse allies. We don't see the setback as a failure because it only renews our commitment to the fight for health equity and justice for our patients and communities.